Now we will discuss the management for neurotoxic snakebite in this segment. Neurotoxic snakebite. In neurotoxic snakebite, what are the features? Features are like there will be ptosis, respiratory distress, etc. Okay, so how will you treat it? Like the previous, we have to give anti-snake venom, we have to give atropine, sorry, we have to give anti-snake venom, we have to give adrenaline, avil, hydrocot before giving anti-snake venom. Okay, in case of neurotoxic snake bite, we will use some agents like atropine, neostigmine, neostigmine. Okay, it will act like how it is act in case of myasthenia gravis. So, in case of neurotoxic snake bite, we have to add atropine and neostigmine with the previous agents. Okay, thank you.